This is Chris Kaiser with MedPage Today in Paris at the European Society of Cardiology meeting, where the Society has unveiled upgrades to its HeartScore program, a web-based risk assessment tool. I spoke with Dr. Ian Graham, project leader of HeartScore, about the tool.
Well, the story starts with the fact, as most cardiologists know, heart attacks are usually the result of 3 or 4 or more risk factors in combination rather than a single big risk factor. And that means the challenge is to assess total risk, or what some people call global risk, quickly and easily for the busy clinician. And this led to SCORE, where we took population studies from 12 different countries, 205,000 people, and we calculated a very simple graphic way of estimating risk, where you simply put in age, gender, smoking, blood pressure, and cholesterol. Then we felt we could do better with this, so we made the interactive electronic version called HeartScore, originally online, but now also standalone. You can download it onto your computer, and that gives an immediate calculation of the risk by entering those simple variables. So that was the first part. The next stage was to help the clinician advise the patient, so it links into the current guidelines on prevention, the European guidelines on prevention, in an interactive manner, so it will give you the appropriate part of the guidelines to help you manage your patient, and also it allows us to print out a very simple advice sheet for the patient with an estimate of their risk, a graphic of their risk, and what will happen if they reduce their risk.
Based on feedback from clinicians, the tool has been refined to make it more practical in clinical use.
What's new, though, are the developments that we've made to this process. The first problem was looking at the protective high-density lipoprotein, HDL cholesterol. When we put that in as the ratio of cholesterol to HDL, it didn't seem to do much. But when we put it in as a separate variable, it's much easier to see how it affects risk.
The risk assessment program, however, is not just for cardiologists, Graham pointed out.
We would like it to be availed of by a wide variety of health professionals. Somehow cardiologists have been a bit paternalistic about prevention. We try to own it too much, and the challenge is to release it and make it easy for other people and for patients, to demedicalize it and make it more accessible, and that's really what we're about.
In Paris, at the European Society of Cardiology meeting, I'm Chris Kaiser, MedPage Today.